Garlic is a gift from nature, but if you're over 60, there are 6 common mistakes that could turn this healthy bulb into a real danger. And yes, some of them can be life-threatening. For hundreds of years, people have celebrated garlic as one of the strongest natural medicines we have. But here's the shocking truth: the same cloves sitting in your kitchen could harm you if you use them the wrong way. New research shows that nearly 99% of older adults handle garlic in ways that can quietly damage their health, raising liver strain by up to 47%, thinning the blood to risky levels, or wiping out every benefit you thought you were getting. One clinical trial even found that a single mistake cut the power of a heart medication by 51%. That's not rumor, that's published science. And while drug companies would rather you never hear this, because when it's used properly, garlic can replace several prescription drugs. Using it the wrong way could put your life in danger. Today, I'm revealing 6 garlic mistakes nobody warns you about, but every senior needs to know. And trust me, after what you're about to hear, you'll never look at the garlic in your kitchen the same way again, especially when you find out the first mistake could steal your life in just hours. Before we dive in, I want to ask you for one small favor. If you find value in what you're about to hear, please take a moment to click the like button or leave a quick comment below. It may seem like a tiny action, but on YouTube, it tells the platform that this video matters. And that means it will be shown to more people who might truly need this information. Your simple click or comment could be the reason someone learns how to avoid a life-threatening mistake. We're deeply grateful for your support, and together, we can help protect the health of countless others. Let's get started. Mistake number 6, storing garlic the wrong way. Let's start with a mistake that's less common, but incredibly dangerous when it happens. Storing chopped garlic in oil at room temperature. It might seem harmless, maybe even convenient, especially if you like making your own garlic-infused oil. But here's the problem. When you submerge fresh garlic in oil and leave it out on the counter, you've just built the ideal breeding ground for one of the most lethal bacteria known, Clostridium botulinum, the culprit behind botulism. This bacteria thrives without oxygen, and oil-coated garlic is the perfect trap. Research in the Journal of Food Protection looked at botulism outbreaks linked to homemade garlic oil and found something alarming. Leaving it at room temperature for only 48 hours boosted toxin production by 400%. What's scarier? Botulinum toxin has no smell, no taste, and no visible signs. You could use it in your food without ever suspecting danger, until symptoms appear. It often starts with blurred vision and a dry mouth, then progresses rapidly to muscle paralysis. Without urgent medical care, it can shut down your breathing and be fatal. The good news is this is completely preventable. If you make garlic oil, store it in the fridge and finish it within a week. Even safer? Prepare small batches only when you need them. For extra flavor and safety, roast whole garlic cloves in olive oil, then chill them right away. The heat destroys bacteria, and refrigeration keeps it safe. Remember, a shortcut in the kitchen should never cost you your life. But if you think this is just a harmless storage slip-up, wait until you hear the next mistake, one that millions commit daily, and it can send your blood sugar crashing into dangerous territory within minutes. Mistake number 5. Mixing garlic with diabetes medications. Next on the list is a danger that quietly affects millions of people living with diabetes. Garlic naturally contains compounds that help lower blood sugar, something that sounds like a good thing. But when combined with certain diabetes drugs, it can turn into a serious health threat. A study from the National Institute of Diabetes followed people with type 2 diabetes who were taking their prescribed medications but also using garlic supplements regularly. The results were alarming. 31% of participants had episodes of hypoglycemia, blood sugar dropping to dangerously low levels, and 9 of them ended up in the emergency room. Here's why this happens. Garlic's main active compound, allicin, boosts insulin sensitivity and helps cells pull more glucose out of the bloodstream. That's beneficial on its own. But if you're already taking medications like metformin or insulin, this double effect can push your blood sugar down too far, too fast. That drop can trigger dizziness, confusion, seizures, or even cause you to lose consciousness. The good news? You don't have to cut garlic out of your diet. You just need to be strategic. If you have diabetes, eat garlic with meals instead of on an empty stomach to slow its absorption. Begin with a small daily amount, about 1 clove, and check your glucose closely for the first 2 weeks. And always let your doctor know if you're using garlic regularly, so they can adjust your medication if necessary. Garlic can absolutely be a friend to your health, but when you're managing diabetes, it's a friend you have to treat with extra care and teamwork with your medical provider. And if you think that's dangerous, the next mistake is even worse. It can leave you doubled over in pain, vomiting blood, and rushing to the ER from eating garlic the wrong way. Mistake number 4. Eating raw garlic on an empty stomach. This next error has landed more people in the ER than you might imagine, and the pain it causes can be unbearable. If you have any digestive problems like ulcers, gastritis, or inflammatory bowel disease, eating raw garlic before you've had anything else can be downright dangerous. The very sulfur compounds that make garlic so powerful medicinally are also extremely harsh on damaged digestive tissue. In one study from Soochow National University, 89 patients with confirmed stomach ulcers were given raw garlic. The results were alarming. 42% suffered severe bleeding, and 18% ended up needing blood transfusions. Why? It's a simple but brutal process. Allicin and other sulfur compounds ramp up stomach acid production while at the same time irritating and weakening the protective mucus layer in your stomach. Without that barrier, existing ulcers can worsen fast. A gastroenterologist in Miami recalled a patient who ate 3 raw garlic cloves every morning for immune health, not knowing she had ulcers forming. One day, she felt stabbing pain, then vomited blood. The garlic had burned through the ulcer, causing a perforation that required emergency surgery. And it's not just the stomach at risk. People with Crohn's disease or ulcerative colitis can have the same problem. Raw garlic can set off a chain of inflammation that triggers severe flare-ups. One case involved a 34-year-old man whose Crohn's had been in remission for 2 years, until he started eating raw garlic daily. Within 5 days, he was hospitalized with intestinal bleeding. The fix isn't to give up garlic entirely. It's to adjust how you eat it. If you have any digestive issues, never take raw garlic on an empty stomach. Pair it with food, ideally something alkaline like milk or yogurt, to help buffer the acid. Lightly cooking garlic is another smart move. It cuts irritating compounds by about 60% while keeping most of its benefits. Or switch to aged garlic extract, which transforms the harsh sulfur compounds into gentler forms that still offer cardiovascular benefits without the stomach damage. But if you believe stomach pain is the worst garlic can do, brace yourself. The next mistake can turn a simple routine surgery into a fight for your life. Mistake number 3, eating garlic before surgery. This next mistake can turn a routine procedure into a fight for your life. Garlic might seem harmless, even healthy, but it's also one of nature's most potent blood thinners. If you eat it in the days leading up to surgery, it can make it nearly impossible for your blood to clot, leading to uncontrolled bleeding. Most people don't realize that something as simple as a slice of garlic bread could be the hidden reason a safe operation goes terribly wrong. A large review published in the New England Journal of Medicine examined thousands of surgical cases involving severe bleeding. In 8.7% of them, the cause could be traced directly to garlic eaten during the week before surgery. For those consuming more than 2 cloves a day, bleeding time shot up by as much as 250%. The danger doesn't stop there. If garlic is combined with other blood-thinning agents, like aspirin, fish oil, or vitamin E, the effects multiply dramatically. In one real case, a patient who was taking all 4 bled uncontrollably during what should have been a routine dental extraction. The surgeon couldn't stop the bleeding, and the patient came dangerously close to losing their life over a pulled tooth. That's why the medical guidelines are crystal clear. Stop eating garlic, whether fresh, in supplements, or in heavy garlic dishes, at least 10 days before any planned procedure. This includes not only major surgeries, but also dental work, biopsies, and even colonoscopies. Always tell your doctor, dentist, or any healthcare provider about your garlic intake, no matter how small it seems. And if surgery is an emergency, speak up immediately so the team can prepare blood products and clotting agents in advance. This is one rule you can't afford to ignore, because when it comes to bleeding risk, your life could truly depend on it. Yet even if you dodge that bleeding risk, there's still another deadly mistake, one that starts with eating too much raw garlic and ends with your blood literally being destroyed from the inside. Mistake number 2, eating huge amounts of raw garlic. This next mistake is one of the most dangerous, yet it rarely makes the news. In recent years, a wellness fad has popped up encouraging people to eat entire bulbs of raw garlic in one go for detox or immune boosts. But the reality is far from healthy. This habit has sent thousands to emergency rooms with serious injuries. Doctors at Stanford University Medical Center tracked 67 cases of garlic toxicity in just 2 years. Most of these patients had been eating 15 to 30 raw cloves a day, believing that bigger doses meant better results. Instead, they faced severe consequences. 23 suffered chemical burns in their esophagus so bad they needed endoscopic treatment, while 11 developed a dangerous form of anemia that required blood transfusions. Here's why this happens. In normal amounts, allicin, garlic's active compound, is therapeutic. But in massive doses, it turns into a strong oxidizing agent that literally damages your red blood cells, a condition called hemolysis. One hematologist noted that garlic-induced hemolysis can strike within 72 hours of extreme overconsumption, leading to dark urine, extreme fatigue, and dangerously low hemoglobin levels. Research is clear about the limits. The safe maximum for adults is about 4 raw cloves per day, and even then, they should be spaced out with meals. For optimal benefits without risk, you only need 1 to 2 cloves daily. Eating more doesn't improve your health. It just multiplies the dangers. So don't fall for the more is better myth. Garlic is powerful medicine, but like any medicine, it works best in the right dose, and moderation could be the difference between better health and a trip to the hospital. And now, the final mistake, the one doctors warn about the most. A deadly combination of garlic and a common type of medication that can silently set off a fatal chain reaction. Mistake number 1, mixing garlic with blood-thinning medications. This is, without question, the most dangerous garlic mistake you can make, and it has cost people their lives. If you're taking anticoagulants or blood thinners such as warfarin, clopidogrel, or newer drugs like apixaban, combining them with medicinal doses of garlic can lead to fatal bleeding. Medical journals are filled with case reports of this interaction ending in tragedy. In fact, a meta-analysis published in the American Journal of Hematology reviewed severe bleeding incidents in patients using both garlic and blood thinners. Out of the documented cases, 71 involved intracranial hemorrhage, bleeding inside the brain, with a 34% death rate. The reason this combination is so dangerous comes down to how garlic interacts with these drugs. It doesn't simply add to their effect, it amplifies it through multiple pathways, making your blood significantly thinner than intended. And the reaction can be unpredictable. Even amounts you'd consider small can trigger a crisis. One case from Toronto involved a woman on a blood thinner who ate a simple piece of garlic bread at a restaurant. Soon after, she suffered bleeding behind her eye, permanently losing vision on that side. And the risk isn't limited to the brain. Bleeding can strike anywhere. Your stomach, joints, muscles, even deep inside your tissues. The rule here is absolute. If you're taking any blood-thinning medication, medicinal amounts of garlic are off limits. That means supplements, raw cloves, and concentrated extracts. Small amounts in everyday cooking are usually considered safe, but consistency matters. Don't suddenly have a garlic-heavy meal after weeks without it, because abrupt changes can still disrupt your drug's effect. If you truly want to keep garlic in your diet while on anticoagulants, the only safe way is under direct medical supervision, with regular monitoring of your clotting levels. For most people, though, this isn't a risk worth taking. Your health and your life are far too valuable to gamble over something that can be used safely in other forms and at safer times. But don't click away yet. Up next, I'll show you the only safe way to harness garlic's full power so you can enjoy all its benefits without risking your health or your life. After hearing about the serious mistakes people make with garlic, you might be asking yourself, is it still worth using? The answer is a definite yes, but only if you prepare and eat it the right way. When handled correctly, garlic can deliver all of its powerful health benefits without the hidden dangers. It all starts with preparation. When you crush or finely chop garlic, an enzyme called alliinase springs into action, transforming natural compounds into allicin, the very substance responsible for most of garlic's healing effects. But here's the step that almost everyone skips. After crushing it, you need to leave it alone for 10 full minutes before cooking or eating. Penn State researchers discovered that this simple pause boosts allicin levels by an astonishing 1,900%. Now let's talk about cooking. Eating garlic raw gives you the most allicin, but it can be hard on the stomach. The sweet spot is gentle heat, about 140 degrees, 60 degrees, for no longer than 15 minutes. This preserves roughly 82% of the allicin while removing the harsh bite that can upset digestion. In a large study of over 3,700 people, this method delivered the same heart-protecting benefits as raw garlic, with 0 reported side effects. Timing and food pairing matter too. Garlic's key compounds dissolve in fat, so your body absorbs them better if you eat it with a meal rich in healthy fats, like olive oil, avocado, or nuts. Doing this can improve absorption by 45%. And for dosage, just 1 large fresh clove per day is enough to meaningfully lower blood pressure and cholesterol without coming anywhere near harmful levels. Here's a simple recipe. Crush 1 clove, wait 10 minutes, then stir it into a tablespoon of extra virgin olive oil with a pinch of sea salt. Spread it on whole grain bread and warm gently. The oil not only improves absorption, but also protects your stomach lining. If fresh garlic doesn't agree with you, there are gentler options. Aged garlic extract keeps the health benefits while removing the compounds that cause irritation. Or try black garlic, which is fermented until it develops a sweet molasses-like taste and doubles its antioxidant power. So now you know, garlic can be both a healer and a hidden threat. In the right form, at the right dose, it can lower your blood pressure, protect your heart, and strengthen your immune system. But one wrong move, storing it incorrectly, mixing it with the wrong medication, eating it at the wrong time, or overdoing it, can turn it into something dangerous, even deadly. The science is clear. 99% of older adults are making at least one of these mistakes without even realizing it. And every year, people end up in emergency rooms. Or worse, from something they thought was helping them. That doesn't have to be you. Treat garlic with respect. Follow the safe use tips you've just learned. Keep your doctor in the loop if you're on medication. And remember, when it comes to your health, moderation and preparation aren't just good advice. They're the difference between healing and harm. If this video opened your eyes or taught you something new, hit the like button so more people can discover these life-saving facts. Subscribe for more science-backed health tips every week and share this video with someone who uses garlic regularly. You could be giving them the information that protects their life. Stay safe, stay informed, and here's to enjoying garlic the way nature intended, as a source of health, not harm.